Hey there, I'm Dr. Barbara Woods. Welcome back to the Intergenerational Trauma Therapist Show, where today we're going to talk about mastering assessment in intergenerational trauma therapy. So, this is a very important strategy and an important way that we have to work with our clients to have a really clear understanding of how the intergenerational trauma has impacted the family system and the individuals within the family system. So today we're going to kind of review some of the foundations of intergenerational trauma related to assessment. We're going to look at key indicators of intergenerational trauma and kind of how these are different from an individual trauma. We're going to look at advanced techniques in assessment and also how we start to integrate these findings in assessment into our treatment planning, which is really why we're wanting to do a very thorough job at doing a full assessment. So, intergenerational trauma, again, is transmitted across generations and just disrupts the attachments in the parent-child relationship. When there's an unresolved trauma in a caregiver, that's typically where we want to intervene because it's in this parent-child dyad that the transmission will continue if it's not addressed. So we're going to look at identifying and assessing intergenerational trauma because it is so critical when we're working with these complex families because of the impacts on generations, not just the parent, not just the child, and not just that parent-child dyad. So the neuroscience behind intergenerational trauma is really rooted in autonomic reactivity, co-regulation, and attachment. So that's all your relational neuroscience. And so the reactivity is related to the trauma symptoms, the dysregulation, the difficulties that people have coping when they've been impacted by trauma or intergenerational trauma. And the co-regulation, so the autonomic reactivity impacts the co-regulation. It's hard to co-regulate, or you'll co-dysregulate someone, and that interferes with attachment. So those are all kind of chained in together and create a process under that umbrella of relational neuroscience that we really need to have a handle on when we're working with intergenerational trauma. So advanced assessment is crucial in this process because the complexity of the intergenerational trauma and its interactive impact on generations creates that need for greater assessment and different assessment strategies and techniques. So it's that interactive impact and the passing on to generations and the complexity that makes it important to have these skills and strategies down. So individual assessment of trauma symptoms gives you information in either the parent or the child. And sometimes if you don't look at the relationship, you'll miss the interactive impacts on the parent-child relationship and on attachment. And if we don't go beyond additional assessment, we won't have the necessary information on the family system and factors that contribute to the passing of intergenerational trauma on to the next generation. So now we're going to look at key indicators. And what we're really looking at is the number one thing that should cue you in that you have intergenerational trauma on your hands is usually disorganized attachment strategies, and that includes parentification. So the disorganized attachment strategies are really kind of misleading because they're really organized, and there's three subtypes. There's a punitive controlling, so that's a very demanding, controlling child that will demand the parent, you get back here now, I want this now, or they won't do anything. So that's a demanding, controlling type, or demanding punitive. There's the parentification, which is a child that starts to learn to cope by taking care of the family needs, taking care of the younger siblings, making sure everything is okay. So they take on a huge amount of responsibility to regulate themselves. The problem is once you pull that responsibility away, they get separated from their siblings, or somebody steps in and says, you just need to be a kid. I'll be the parent. They can completely fall apart. And that's when you'll see more of those kind of disorganized strategies. And the last subtype is just disorganized. These are really unpredictable. There's really no way to map out how they may react in different situations and in different interactions. So those are the three that we need to look for. And that parentification can be a tricky one because it looks like they're doing really well. They're coping really well for the situation and they're taking care of their siblings. But this is a strategy that's keeping the lid on all the dysregulation and the difficulties that they actually are experiencing. So when you have disorganized attachment strategies, it typically is related to a scary or scared parent. So it's a parent who is scary. They're harsh, punitive, controlling. They may be very aggressive in their parenting, use kind of corporal punishment. So they can, or they yell they use indirect violence. They'll be violent towards the spouse, but not towards the kids. But that's a scary parent. So they scare the child, but the child still needs that parent. So it's a conflict between being scared and needing that parent. Or the presentation of the parent is one that's kind of helpless, scared, they're easily startled, they have these are the impacts of trauma. So the child will step up and try to take care of the parent. So they may be impacted by that trauma to create this presentation in the parent. So that if the parent has unresolved trauma, they may be highly reactive and aggressive and scary, or they may be kind of helpless and have more of a presentation of being scared. So we're going to look at, I think, 3 or 4 different areas that we want to really look at these key indicators. First is when parents use parenting strategies that backfire or having significant frustration in the caregiver. So if a caregiver has not worked through their own trauma and has not done the work to address the difficulties and the current impacts on themselves, the child's trauma responses or behaviors can be very triggering for the parent. So they can, if they haven't worked through their trauma, they're more likely to be reactive to the child's trauma as well. So it creates like a synergistic effect. And parents can be traumatized by their child's trauma because it's happened to somebody you care about, you love. So they can have kind of secondary traumatization, and they can be re-traumatized by their child's behavior as well. So the child's behavior, if it's a lot of fight and flight and bad things happen when the child gets in those reactive modes, it can be really traumatizing for the parent, or it can re-traumatize them from their own experience. So this is where we really need to be careful and watch these parenting strategies, because when they're in this cycle, they may feel kind of out of control. They need to clamp down or do something to get this to change. So they'll get more harsh and controlling. The strategies will increase as far as being punitive or controlling, high expectations. And this is out of their frustration or fear, and it only further disrupts the parent-child bond. They may be repeating a pattern that was in their parent-child dyad, the parents, so that it may be a family pattern that's repeating, and they may feel that their strategies aren't as bad as what they went through. So they may have been in a family system that was physically abusive and verbally abusive, If now they're only verbally abusive, their perspective may be that they've improved things. So there's nothing to be said about it. But the impacts and the carrying on of that trauma is going to happen in their own relationship with their child. So parents that work through their own trauma are sometimes they're not as reactive, or they can regulate and manage in the face of trauma reminders. So they have dealt with and addressed their own personal trauma. The difficulty is this addressing of their personal trauma doesn't necessarily cross over into their parenting. So you can have somebody that's done years of therapy and has been very successful, had very good impacts, but they have excessive reactivity toward the child's behavior because of unresolved impacts of trauma on relationships. So in particularly in the parent-child relationship. And that's something that in individual therapy, a lot of times you wouldn't address the larger aspects of how that trauma has impacted the parent. The next area we want to look at is co-regulation, and that autonomic reactivity creates difficulties with co-regulation because they can't attune or respond to the needs of the child. They get frustrated or they shut down. So that's where they have that attunement lacking, and it creates difficulties with attachment. They can't recognize the underlying needs of the child, sometimes their emotions, their autonomic state. So they just can't connect in an effective way to know how to soothe, calm, repair with their child. They may also feel very overwhelmed or helpless in how they respond to their child's needs or reactivity because may not have ever had this experience with a caregiver. So they don't have that felt sense or felt experience of what it's like to be attuned to, what it's like to be cared for from a caregiver, that they don't know how to give that to their child, and they may not recognize the importance of it as well. So now we're going to look at very subtle distinctions between general trauma indicators and intergenerational trauma indicators. So we're going to look at differences in trauma narratives, or how they understand the story of what they've been through. So individual trauma narratives are usually related to an event or a personal experience. It's kind of it's contained by that experience, and it may have little impacts outside of that, but the narrative or the story is really about the event that they experienced and their experience of it. So intergenerational trauma narratives they're repeated through generations. There's messages and communications that are sent about life in general, about safety, about trusting organizations or authority. And these narratives impact the child's self-concept and their understanding of the world. So it's kind of woven into their perception of the world and life in general. So it's much more difficult because it's not just contained to this one event or experience. It's just kind of woven into everything. So the narratives between the two are very different. The next area we look at is the differences in family roles and dynamics. So children who are impacted by trauma, they may have behavioral impacts, but they're kind of defined by that incident or circumstance. They weren't there before. Once it's addressed, they may not be there after. We hope they won't be there after. But it's really defined by that experience or reminders of that experience. Intergenerational trauma, on the other hand, creates very rigid family systems or roles that people cannot step out of. And if you do, there's huge consequences for that. So you can end up developing these unhealthy patterns through generations, including that parentification. So the coping strategies between individual trauma and intergenerational trauma are also very different. In intergenerational trauma, the coping strategies are really inherited through the generations of how they approach the world, how they understand the narrative of what's happened through the generations. So you may find families with themes of they avoid anger or they're very explosive, and that's kind of just who they are. They may be withdrawn from supports, they may be kind of distrustful. They might seek out excessive relationships, and it may be the norm that relationships change all the time, and there's a lot of significant relationships, but they're short in duration. So that's very different than the coping responses for an individual's trauma experience, because those coping responses are developed close in time to the event, or they're over time following the event. They aren't woven into the fabric of the family. There's also differences in communication patterns. Usually with intergenerational trauma, there's communication patterns that are based on avoiding topics. So we just don't talk about that. And if anybody brings it up, the whole family, you can feel the tension. Um, or we try to avoid triggering the older generation. So we'll learn that talking about a specific topic is something that will trigger the older generations, and the whole extended family system may be built around or organized around avoiding bringing that up in front of an older generation that has gone through maybe some type of historical or cultural trauma. In individual trauma, there's changes in communication, but it's either directly related to the incident or they're things that are similar. So they may avoid discussions. They may not be able, they may kind of regress or not be able to form their thoughts or words when they are responding to a trauma reminder. But they're not these things that are woven into and having woven into the family and have very significant consequences if you kind of break out of that. The fear responses between individual trauma and intergenerational trauma are also very different. So, individual trauma usually results in very specific fears. So, they'll have fears that are related to the stimuli that they had during the trauma or things, their experiences that remind them of the trauma. Intergenerational trauma can create very pervasive fears that are woven throughout life. So it's not just fear of dogs or weather changes, it's fear of everything. It's fear of authority, fear of people, fear of change. It's woven into anything. And it can also develop into distrust of people, organizations, schools, authority. So it's really important to get an idea of where these fear responses are occurring. At the same time, some families no longer have a fear response and they're like very courageous and brave, but can be very destructive in that courage and bravery. So these fear responses are usually rooted in previous generations' experience rather than the presence of a current stressor. So, of course, we need to look at the impact of historical and the cultural context of assessment. So, we want to look at identity development and really cultural disconnection. So, in intergenerational trauma, this impacts identity development, and it specifically impacts cultural identity and connection or integration of their family history, of their culture, of their people's history. So this is very different, whereas individual trauma results in disruptions to their personal identity. They may think I'm a bad kid or I'm unlovable, but they don't think that the whole world is out to get them or the world is a terrible place and you got to get somebody first before they get you. So it's very different. And the cultural identity is disrupted at a larger level and may not, for individual trauma, it may not be related to cultural identity either. So what we need to watch for is the trauma narrative maybe with intergenerational trauma, may be interwoven with the cultural identity, which is really important to support because cultural identity is a real resilience factor that if we can get to that and integrate that into the individual and the family system, there's a huge positive benefit of that. So the cultural disconnection, individual trauma causes a disconnection from the self. So we're not maybe aware of some of our responses. We have kind of integration of memory difficulties. We may kind of numb out at certain times and we kind of disconnect from ourselves and our experience in the moment. Intergenerational trauma causes a disconnection with cultural roots, practices, and values. There may be a lot of messages in the family that we don't practice that part of the culture because it's been said that it's evil for many generations, that we just don't practice that. And it gets woven into um, kind of a disconnection from their cultural identity, which again, cultural identity and their practices and the roots of that and the values are all huge resilience factors. So the historical and cultural context of a family is part of those deeper layers of intergenerational trauma and reaches into other areas of identity and life. And I have a little drink, my Michigan cup. So now we're going to look at advanced techniques in assessment. So most trauma assessment focuses on the individual impacts related to PTSD or related to trauma. So we'll look at hypervigilance, intrusions, avoidance, and changes in cognition and mood. That's basically what we're looking for in individual trauma. Attachment assessments primarily focus on the parent-child relationship and work towards addressing those relational difficulties. So we'll work on attunement, co-regulation, repair. We're trying to build that parent-child relationship to heal some of that and build a stronger relationship. But when the parent has unresolved trauma from their own experience, the attachment interventions can be quite limited in their effectiveness because that's kind of where you can do a lot of work on your own trauma responses and your experience, but that doesn't necessarily translate into changes in your attachment with a child. So that's where this can get a little tricky, especially if you're working with a parent that's been through a lot of therapy and is doing really well. They may still have this pocket over here that is related to the impact of intergenerational trauma on their parenting and their ability to regulate within a parent-child relationship. So individual or parent-child assessments don't include an assessment of the larger family system to identify factors that either contribute to the difficulties or maintain the transmission of the trauma over generations. And they contribute to the difficulties in the current generation. So one very helpful strategy is the 5 domains checklist. And this is something that I've developed after years of working with these families of things that you see more in families impacted by intergenerational trauma than you'll see in individual trauma. So we look at the family system a little deeper, and it's a deeper assessment of the difficulties in the parent-child relationship. So we look at factors that impact therapy because you can step on a landmine and you won't even know you've done it until you hear that click and it's too late. So we have to have a framework to draw on when we're working with a family to avoid certain difficulties that they may have with engaging in trauma therapy or family therapy. Another area that we want to look at is difficulties in co-regulation, parenting strategies that backfire, how the parent mentalizes the child's behavior. So if you ask a parent, well, what do you think he or she was thinking when this happened? And if the parent says, oh my gosh, they are so controlling, they're just trying to drive me nuts, that's very different than, I think my child was really scared when he or she did that. That's a very different interpretation. We want to know how the parent observes and witnesses the child's behavior. We also want to look at the child's negative self beliefs because those beliefs are what will go underground and will continue that cycle of trauma in their own children or in future generations. So, when we look at taking these interventions and assessment techniques into standard therapy practice, individual assessment of any type of parent child relationship, their trauma symptoms, attachment assessment is recommended as a baseline for the individual impacts of the current situation and targets for individual interventions. So we can still do that assessment. We can still use our attachment assessments as well. One of the things that will really set you up for success with intergenerational trauma is having a very thorough intake assessment and a referral process if you're having clients referred by like child or family services where they're involved in child welfare or child protection. The social workers will have a lot of information that's very critical to understand when we're working with these families. So if we get that at assessment and during the referral process, it gives us so much more information so that when we look to start intervening, we have a very clear map of what's happening within a family and what's happening for the family member, each family member. So the 5 domains of impacts, that helps identify those significant attachment and relational impacts in the parent-child relationship. So you can use this as a guide to ask further questions at the beginning of therapy, kind of like a rubric of things that you should be looking for or asking the parents and the child in order to look for further information and more assessment. Or you can also use it as a continual assessment, kind of a running document of what's emerging when, because this is really complex. The impacts of intergenerational trauma and the transmission, they're actually very complex. So the more we kind of run through these impacts, the more as the layers get peeled away, we'll see different parts of the impacts. We'll be less surprised and we'll be a lot more effective. So we also want to continually be looking at how intergenerational trauma impacts the therapy process and therapy in general, because we want to have a critical awareness maintained throughout therapy so that we can provide effective therapy services, but also so that we can have really solid relationships with both the caregiver and the child. So many of our clients who are impacted by intergenerational trauma, they have had many, many negative experiences with professionals, just like us. And these may have happened over a long period of time. So we have to be very proactive at relationship building and developing that relationship more so than in other cases. Other cases that don't have these relational impacts may be very easy to establish a therapeutic relationship, and the client may be more primed for trust and co-regulation and interaction and feeling supported and helped. But people who have had intergenerational trauma have an extra difficulty with engaging because they don't have that trust. They may have never had an experience with somebody who understands and cares for them. And that might be quite triggering or cause them to feel kind of a fear response. So compassion and attunement is critical for the parent, for the child, and for the family system. So one of the concepts that I work with in working with families is multipartial directionality. So being multipartial to all family members and previous generations is very important so that we're not kind of dividing against or siding with the client and triangulating within the family system. We have to have consideration for the whole family system when we're working with these cases. And that only supports, even if you're working with an individual, that only supports their therapy because it helps them understand kind of what may have happened in their family. We also need to work within the cultural beliefs because this will remove a barrier that may create extra difficulties in developing that relationship and making progress. So if you get a referral from a culture that you're not familiar with, you need to get support, you need to get guidance, supervision, and you need to maintain that cultural humility. That's one of the most important things that we can have as therapists when we're working with someone from a different culture. So the impacts of cultural and historical trauma also need to be integrated into the therapy to address those impacts of that intergenerational aspect and to integrate that intergenerational resilience. That's really what we want to get to, is that intergenerational resilience. And there is always resilience there because the family lineage has survived. So that it's always there. We just need to go back and find it and integrate it into the current family system. So how do we take these findings of assessment and put them into treatment planning? That can feel like a very difficult task. And comprehensive assessment is critical for the treatment planning, which treatment planning we're going to talk about next week. So it provides the roadmap for intervention as well as engaging the family in therapy. So with a comprehensive assessment, it's possible to identify the most impactful path for healing the family system. So in the intergenerational trauma program, it's both structured and flexible to meet the needs of these complex families in order to reduce activity, shut down, support attachment, and build that family resilience. So we want to stabilize the family system and work through that trauma. So in the program, it's made up of 3 different phases. First is kind of parent coaching, which helps calm the family nervous system and builds the foundation for attachment. Second phase is working on the parent's unresolved trauma, the complex trauma. Third phase is working on the children or teens' trauma and also building family resilience. So in its most structured form, you would have a parent complete phase 1. So we calm the family nervous system. We look at autonomic regulation, co-regulation, attachment, and parenting skills. Then the parent goes through phase 2 and works on addressing their own complex trauma. Then we move the child or teen into phase 3, and this is done with the support of the family to address the teen or the child or teen's impacts, but also build that family relationship and really support that attachment and connection. So that's your most structured. This is what you'd want to use if you're doing this in groups or with waiting lists. If you want to reduce the waiting list, this is a really good way to start that because it can be done as a group. If you're working with a family that has separation of the parent and child, so possibly like a child that's in foster care and they're maybe, say they're looking towards reunification. So what we could do, best case scenario would be the foster parent and the biological parent take phase 1. So they both learn consistent parenting strategies and consistent interpretation of the child's behavior and attachment strategies. So it makes a lot of consistency for the child and between the foster parent and biological parent. Now, how you would do this would depend on how much connection or relationship the foster parent and the biological parent have. If it's maybe the grandparent and a parent and the grandparent's fostering the child, you could do that in therapy together as long as they were able to do that work together. So you could really do some really good family work with the grandparent and the parent to support the child. If it's a foster parent that has no connection to the biological parent, you could do this separately because there may be some tension between that would not be very effective or useful. Could even lead to possible placement breakdown. So you want to be really careful with that. So after phase 1 for the foster parent and the parent would continue through phase 2 to address their complex trauma. And the child could begin phase 3 at the same time as the parent. And then the parent, that you start phase 3 in the family resilience part of it when there's reunification getting closer and closer. So if you have a family that's excessive with reactivity or shutdown, it's a really highly kind of stalled family. There's not a lot of communication, not a lot of connection, or the communication and connection is very hostile and very reactive. You can do this a whole different way. So you could start the parent in phase 1 and the child in phase 3 all at the same time. So they're both getting the trauma responses and their trauma experience addressed. The parents is more to build the foundation of attachment, co-regulation, and really to prime them to do the work on complex trauma. It's really kind of a foundational part of doing their own complex trauma work in phase 1. So once they complete phase 1, they can move into phase 2, address those complex trauma difficulties, and then you could also alternatively start the parent in phase 2 if they're highly reactive and it's impacting the relationship and they need relief from their own trauma more immediately. You can start with phase 2 for the parent where you address their complex trauma. So the framework is very structured, but it's also very flexible because these are really complicated families that you can't go in with a rubric and put them through the same thing, because by the time you get to address the parent's complex trauma, the family may have already fallen apart. So we have to know how to kind of navigate and plan for these families. So the most important guiding principle in intergenerational trauma treatment planning is to give the family efficient and effective interventions. And this is so it gives them significant relief right away. It builds hope that there is change possible and that things can help and work. And it also creates a belief in the family systems, in their healing, and in change in general. So this is why advanced assessment is really a critical foundation of intergenerational trauma therapy. It guides that path of interventions and helps us identify those potential pitfalls because they are there, so that we can avoid them or address them in therapy. That thorough assessment also provides a method to design that most effective and efficient way to approach each family to get the family relief, to build hope, and to demonstrate that change is possible. So this is such a big area that I can't cover all of it in this video, and it's critical for intergenerational trauma therapy. So the complexity of effective treatment requires that specialized training and certification and knowing how to apply these concepts. So I would encourage you to consider a few cases that you've worked with and your assessment process with those cases, and look at what are some of the areas that you got this down and you got that covered, and you should be very proud of yourself for figuring that out. Probably took a lot of training, a lot of reading, and a lot of resources to be able to make that happen. And I would also ask, like, what are some areas that may need to be added to advanced assessment strategies to improve your assessment and treatment planning in these cases? So if you haven't gotten your copy of the 5 domains of impacts, you can go to 5domainschecklist.com, and I'll post that around this video. It's a free copy and there's training that goes along with it. So it'll kind of introduce you to the checklist and kind of what to look for when you're working with families. And next week, we are going to look at advanced assessment and move more into treatment planning? And how do we go from using these advanced assessment skills into the treatment planning? So I hope to see you then, and I hope you have a beautiful day.